Hey everyone, Dr. Charlie, physical therapist at Physical Therapy in Johnson, and I want to zoom in on the topic of a weak and painful shoulder. So I want to go through 4 simple signs of a weak and painful shoulder, okay? So the first one is that you have a positive wing test. I made the name for this up. My wife called it like a chicken wing or a wing test when I showed her what it was, so that's what we're going with, okay? So basically, you have pain either in the front of the shoulder, maybe in the back, or right on the side, near the shoulder joint, and you're going to cross whatever shoulder it is, okay? So let's just say it's the right shoulder, okay? You're going to cross that over, put the hand on the opposite shoulder, and if you have pain there, stop. But if you don't, then try to raise your shoulder up towards the ceiling, and you might feel a little bit of a pinch in that shoulder. Compare that to your side where you don't have pain, and you might notice that it's perfectly fine, okay? So the wing test, cross it over, lift it towards the ceiling. If you have pain, then that's a sign that some of the muscles or tendons in the shoulder are irritated, okay? The next thing would be a pinch at the top of the motion. So maybe you're reaching overhead in your cabinet, or you just want to take your arm, turn to the side, thumb up, okay, raise it straight on up, and you might notice that at the very end you get a little bit of a pinch at the top of the motion, okay? Again, this was classically termed shoulder impingement, okay? So some structures, again, getting irritated in the shoulder at the top of the motion, all right? Again, the third sign of a weak and painful shoulder is what we call a painful arc. So you're going to stand there, try the test on your side that doesn't hurt, see how it goes, palms forward, thumbs up, raise it up, and you might notice that kind of between this degree and this degree, so right in this arc of motion, you have some pain on the front, top, or maybe in the back of the shoulder, okay? So that's called a painful arc. And then you have pain with resistance of some of the muscles in the shoulder. So what you're going to do, okay, is you're going to take, let's just say this was my problem arm and I had pain in this shoulder. You're going to take it, okay, and you can stand and you can hopefully see it. I'm giving a little bit of resistance. I'm trying to push into my hand. You could stand next to a wall and try to gently push into a wall. That would work as well. But if as you're applying a little resistance and you're trying to push into that object or using your own hand, you notice pain in the shoulder, then that is another sign, again, that some of the tissues in the shoulder are weak and therefore are painful, okay? So the treatment of this is fairly straightforward in that we're trying to calm the tendons down, allow them some time to heal, but really we do that through actually improving the ability for those tendons to handle some load. So we actually kind of strengthen the shoulder because the shoulder is weak and therefore it's painful, okay? So we work to strengthen the shoulder, get you moving better, and therefore get you feeling better. So if you have any questions and you think you have a weak and painful shoulder, call us directly at 484-552-3767 and we'll check it out.